Recently, I posted a video looking at whether robots were gonna put me out of work. Is this the beginning of the end for me as a joint replacement surgeon?
These people from the future are taking all the work away from us decent present-day Americans.
In this video, I'm looking at something a little different. Last week, I asked you guys to submit your orthopedic questions to me. And today, we're gonna present those questions to Chat GPT to find out just how smart AI really is.
She gets smarter with the more interaction she has.
If Dr. GPT is way off base, I'll step in to set the record straight. Please note that in some cases, I've altered the wording of the question slightly, or in cases where several questions are rolled into one comment, omitted part of the question. Now, let's get down to business. Let's say adamantium existed. Could we, with current technology, create a Wolverine-like skeleton and implant it into a person?
No.
Whoa, that's a mouthful. If adamantium, the fictional metal known for its association with Wolverine, existed in reality, creating a Wolverine-like skeleton with current technology would be extremely challenging, if not possible. Check 1 for Chat GPT.
Do you concur?
I agree. Adamantium is depicted as an indestructible and extremely dense metal, making it difficult to manipulate or shape with existing manufacturing techniques. Additionally, implanting such a skeleton into a person would involve complex surgical procedures and compatibility issues that are beyond our current capabilities. I also agree.
So you concur?
Because of its properties, it is something that is very difficult to work with, meaning that you would probably have to work with very high temperatures in order to mold it or shape it to some of the complex shapes that are found in the human body. Generally speaking, those temperatures are not really conducive with biological life. Moreover, to put something like that inside of a human being would, as ChatGPT has said, require many operative procedures. Kinda along the lines of something like out of the Space Marines, which we've talked about before. It's important to remember that Wolverine and his adamantium skeleton are fictional creations from the world of comics and movies, no doubt.
The destroyer of dreams.
While advances in material science and medical technology continue to push boundaries, replicating something like an adamantium skeleton is purely speculative and remains well beyond our current reach. Basically, I will have to concur with ChatGPT.
Why do not concur?
Although it would be very cool for us to be able to create something like this, this is well beyond our current state of technological ability and something that we will have to wait for many years, possibly even many decades, before we are able to do something like this. Clearly, the intern army doesn't pull punches, considering this is the type of question video that would literally constitute an entire freaking video. Okay, let's try something a little more direct. Maybe ChatGPT can guide us through some bread and butter orthopedic procedures. What actually happens in an MCL ACL repair? Well, one thing I'll give you, ChatGPT is hella quick. All right, let's break this down and see if ChatGPT knows what it's talking about. MCL, the medial collateral ligament, and ACL, anterior cruciate ligament, repairs are surgical procedures, yes, that are commonly performed to treat injuries to these ligaments in the knee. In an MCL repair, the surgeon typically makes a small incision over the injured ligament and may use sutures or anchors to reattach the torn ends of the ligament. Oh my goodness, ChatGPT is good, yo. In some cases, the surgeon may also use a graft, which is a piece of tissue, often from a tendon, that is used to reinforce the repair. Check and check. Generally speaking, when we repair the MCL, because it's on the outside of the knee and thus part of the capsule of the knee, usually injuries occur at either its insertion on the tibia or its origin on the femur. And in both of those cases, we can use suture anchors to repair the ligament back down to the bone. In some cases, the injury will occur in the mid-substance of the ligament, meaning just in between both of those bones. And in those cases, we'll actually have to do a suture repair in the mid-substance of the ligament. So far, so good. An ACL repair involves reconstructing the torn ACL rather than repairing it directly. Bingo. The surgeon will typically use a graft, which can be taken from the patient's own body, also known as an autograft, or a donor, an allograft. Common autograft options include the patellar tendon, hamstring tendons, or quadriceps tendons. Chat GPT is up to date. The graft is secured to the bone using screws or other fixation devices, and it is positioned to function like the original ACL. All of this is true, and all of this is accurate. Both MCL and ACL repairs are performed under anesthesia, and the specific surgical techniques and approaches may vary depending on the severity of the injury, the patient's individual circumstances, and the surgeon's preference. Giddy up. As ChatGPT has mentioned, there are a number of graft choices that are possible, and this is partially due to the surgeon's experience and to the patient's preference. And in addition, there are a number of different techniques where you can do an all-inside technique or more of a conventional standard ACL reconstruction approach. ChatGPT goes on to say that rehabilitation and physical therapy are crucial components of the recovery process to regain strength, stability, and range of motion of the knee. It's important to consult with a qualified orthopedic surgeon for a comprehensive evaluation and personalized treatment plan if you have concerns about MCL or ACL injuries. Well, 2 questions down, and I gotta give 2 points to ChatGPT. So far, so good. I was expecting ChatGPT to do a lot worse, but so far I can't really complain. So, okay, Dr. GPT, here's another simple one. Maybe you can apply some of the information from the previous answer to this question. Question number 3. In a trauma situation, what goes into repairing connective tissues such as tendons and ligaments? Also, how are nerves repaired, or can they not be? Does any of this fall under the realm of orthopedic surgery, or would another surgeon handle this, even if involved in a major joint or other bone injury such as a compound fracture? That's a good question. This is a long one. ChatGPT is doing a lot of thinking. In a trauma situation involving injuries to connective tissues like tendons and ligaments, the repair process can involve various techniques and approaches. That is true. Here are some common procedures. Tendon repair. Tendon injuries can be repaired by suturing the torn ends of the tendon back together. This is indeed true if the tendon tissue is of good enough quality to allow this. This also requires that the injury occur in a part of the tendon where there is tendon on both sides of the injury, as opposed to tendon on one side and muscle on the other side. In some cases, GPT continues, the surgeon may need to use a graft, usually taken from the patient's own body, to reinforce the repair if the damage is extensive. And this is quite true. A ligament repair. Ligament injuries often require reconstruction other than direct repair. This involves using grafts, autografts, or allografts to replace the damaged ligament. The graft is secured to the bone using screws or other fixation devices. This is also true, as we've just discussed with the anterior cruciate ligament repair or reconstruction. Generally speaking, ligaments are reconstructed rather than repaired. Although these days there is some trend towards attempting repairs for these ligaments. Nerve repair is a complex process and depends on the type and severity of the nerve injury. In some cases, nerve endings can be directly sutured together if they are cleanly severed. This does occur. And generally speaking, it's plastic surgeons that will do this type of microvascular or very fine work. However, nerve regeneration can be challenging. Definitely. And sometimes nerve grafts or transfers from other areas of the body are required. Also true. Nerve repair may fall within the scope of both orthopedic surgeons and specialized surgeons such as neurosurgeons or hand surgeons, which are basically either orthopedic or plastic surgeon subspecialists, depending on the nature of the injury and the specific expertise of the medical team. Orthopedic surgeons often handle major joint injuries, bone fractures, including compound fractures, and associated soft tissue injuries. Bingo! That's what I do. They are trained in the management of musculoskeletal trauma, which encompasses the repair of bones, tendons, ligaments, and some nerve injuries. Not all orthopedic surgeons are trained in the repair of nerves. We do undergo some very basic nerve repair training when we do our orthopedic residency, but generally this is something that requires subspecialty training after residency. However, In complex cases involving severe nerve damage or specific expertise in nerve repair, specialized surgeons may be involved, and usually this is the case. It's important to note that the precise treatment approach and the involvement of different specialists may vary depending on the specifics of the injury, the location, and the resources available at the medical facility. This is also true because this type of fine, delicate work cannot be performed at all surgical sites. Sometimes you require special equipment and subspecialty training, which can only be found at tertiary care or large university centers. In emergency situations, a multidisciplinary team of surgeons and medical professionals may collaborate to provide comprehensive care. And this is quite usually the case. Obviously, any fractures will require the expertise of an orthopedic surgeon. Bingo! However, any microvascular or fine neurosurgical work will often require subspecialist assistance from either a plastic surgeon, neurosurgeon, or a subspecialty trained orthopedic surgeon. So let's try another one. How do you deal with people who can't tolerate the materials used in their joint replacement or other implanted hardware? And what's the current state of treating long-term or chronic joint dislocation? Two very good questions. Let's see what Chat GPT has to say. So really, this is two separate and unrelated questions. So we'll break it down and answer each one at a time. For the first question, Chat GPT replies, when individuals experience intolerance or adverse reactions to materials used in joint replacements or other implanted hardware, several approaches can be considered. Let's see what they are. Allergy testing. Allergy testing can help identify specific allergies to certain materials, such as metal components or cement used in joint replacements. Based on the results, alternative materials that are better tolerated can be explored. Material selection. In cases of known material intolerance, alternative implant materials may be used. For example, if a patient has a nickel allergy, implants made of nickel-free alloys or ceramic components may be considered. Quite frequently, we have patients who have expressed metal allergy, and each of the metal components that we use in a typical joint replacement usually has some level of nickel that's associated with them. Most of those implants are comprised of alloys, which usually contain some nickel. Generally speaking, the titanium implants are not a problem, and these are well tolerated by most people. However, the stainless surgical steel or the alloys of chrome, those are the implants with which patients may have a problem if they have a nickel allergy. And it's with those patients that we are required to use alloys that are more rare or have been treated with additional coatings such as ceramic. Revision surgery. If the intolerance is severe or causes significant discomfort or complications, revision surgery may be necessary. This involves removing the problematic implant and replacing it with a different type of material that the patient can tolerate. Usually, we hope to know about allergies to metals before we've implanted an implant into a patient.
Why didn't you tell me?
However, this is not always the case because sometimes the patients themselves don't know that they have an allergy. If we find that the implant is not tolerated or poorly tolerated, and we determine that it's because of some kind of allergy to metal, then we are required, but at that point in time, to revise the implant, meaning we have to open the patient back up and we have to take that implant out.
This is absolutely disgusting.
And then replace it with an implant that does not have the metal to which they are allergic. So those answers to the question of a metal allergy are quite accurate, and I have no problems with that. Let's chalk up another point for Chat GPT. As for the second question, regarding the treatment of long-term or chronic joint dislocation, the approach can vary depending on factors such as the specific joint involved, the severity of the dislocation, and individual patient characteristics. Here are some general strategies. Let's see what they are. Close reduction. In less severe cases, a skilled healthcare provider may be able to manipulate the joint back into its proper position through closed reduction. And this just means that we're going to apply some traction and we're going to gently position or maneuver the joint back into its location. This technique, Chat GPT goes on to say, does not involve surgical intervention and is usually performed anesthesia. That is correct. However, in the case of a chronic dislocation, this is much less likely to be effective because over time, since the joint has been out for an extended period of time, usually the ligaments that stabilize that joint are going to be looser than they might otherwise be. And so they are not going to really provide as much restraint as you would expect. And while it may be possible to do a close reduction and get that joint into position, it's going to be a lot harder for that joint to stay in position after it has been reduced as a result of the laxity of those ligaments. Open reduction. In more severe or complex cases, open reduction surgery may be required. This involves surgically accessing the joint to realign and stabilize it using techniques like sutures, screws, plates, or other fixation devices. And this is often the case with these type of chronic dislocations. Given the chronic laxity of the stabilizing ligaments, we usually have to perform an open reduction and then some type of ligament repair to address the looseness or the laxity that's associated with those stabilizing soft tissue structures. Joint reconstruction or replacement. In cases where the joint is extensively damaged or recurrent dislocations occur, joint reconstruction or joint replacement surgeries may be considered. And this is true, particularly if the chronic dislocation has occurred over a long period of time and then resulted in significant loss of the articular cartilage of that joint. We are now faced with a bone-on-bone situation where not only is the joint unstable, but it is also arthritic as well. These procedures aim to restore stability and functionality to the joint. It's important to note that the treatment of long-term or chronic joint dislocation requires a thorough evaluation by an orthopedic specialist who can assess the specific situation and recommend the most appropriate treatment plan based on the individual's condition, overall health, and goals of treatment. All of which is true. Man, I'm a little bit disappointed actually, because I thought that Chat GPT would be worse than it is. Bye, hater. So far, we are actually 4 for 4. Well, since this was a 2-part question, let's say 5 for 5. Good on you, Chat GPT. Okay, Dr. GPT, you've obviously been studying. So, tell me this. What's the worst possible injury modern orthopedic surgery can potentially fix? And what's the most mundane injury that it cannot fix? Somebody's pulling out all the stops. That's a tricky one. Let's see how good ChatGPT's game is here. Orthopedic surgery has made significant advancements and can address a wide range of injuries and conditions. While there are limitations, it's challenging to define the worst or most mundane injury in absolute terms, as it depends on various factors. Seems to me like ChatGPT is trying to wiggle its way out of this question. However, here are some examples. The worst possible injury modern orthopedic surgery can potentially fix. Modern orthopedic surgery has the capability to address severe fractures, complex joint injuries, spinal cord injuries with associated bone damage, extensive soft tissue injuries, limb amputations with prosthetic replacement, and conditions like osteosarcoma requiring limb salvage surgery. All of this is true, pretty standard, but ChatGPT, you ain't telling me anything yet. These procedures can often involve reconstructive techniques, bone grafting, joint replacements, or complex stabilization procedures. That's standard stuff, and probably you could just find that out by checking out on Google. The most mundane injury modern orthopedic surgery cannot fix. Orthopedic surgery has limitations, and there are certain conditions it cannot completely fix or may have limited interventions for. Examples of relatively mundane injuries that may fall into this category include minor sprains, strains, or small avulsion fractures that heal with conservative treatments like rest, physical therapy, or bracing without the need for surgical intervention. All of which are true. In these cases, the body's natural healing processes are generally sufficient and surgery may not be necessary. Again, this is true, but this answer is kind of weak sauce, if you ask me. So far, we have answered 6 questions, and ChatGPT has done pretty well on all of them. This last question was a little bit weak, but I'm still gonna give ChatGPT a pass. It hasn't said anything that is categorically false. I wouldn't necessarily go to Dr. GPT for specialist consultation, but for general answers to orthopedic questions, Chat GPT gets a passing grade. So thanks for joining me on this investigation of orthopedic AI intelligence. If you'd be interested in another video like this, leave your questions down below in the comment section. Remember to join me at my online gym, Human 2.0 Fitness, for free, right here on YouTube, where we help you prevent injury and move better. If you enjoyed the video, be sure to comment and subscribe to the channel. And if you didn't, be sure to let me know why in the comment section down below. Although I couldn't understand why you wouldn't enjoy this. Otherwise, as always, that's been a word from Dr. Chris, not your everyday ortho, where we see one, do one, and teach one.